Okay.
Sorry, look. Good go.
You are dispatched to a 70-year-old male with severe back pain and feels faint.
Said 70-year-old
Male?
male with faint back pain.
Yep. With feels faint, severe back pain.
Oh, he feels faint and has back pain.
Mm-hmm.
Alright. Is my scene safe?
Yes.
Going to put on PSIs and gloves. What's like number of patients is 1?
Yep, just one.
What is my general impression just looking at the guy?
Elderly male patient is lying on his living room couch, appearing pale and anxious.
Is it possible at all that he fell?
No, he did not.
Okay. So we're gonna say no for C-spine. Let's call additional EMS just in case. Let's see. C-spine, additional EMS. Number of patients. C is safe. Okay. Shoot, what am I doing? Let's see. So he's laying on the couch, 70-year-old male, feels faint, and he has back pain. If I say like, hey, I'm Tanner from the ambulance, what seems to be the problem today? Does he give me a response with full, complete sentences?
Yep, he says, my back just started hurting suddenly. I think I can feel it in my chest too.
Okay, so we're gonna say that he's alert. His chief complaint is chest pain and that he feels faint, or back pain, and he feels faint. And you said he can feel it where else?
He has some in his chest, some pain in his chest.
A little bit of pain in his chest and back pain. Okay. That's the chief complaint. He's alert. Let's see, is his airway patent?
Yes.
Okay. Beautiful. What's his rate and depth of breathing?
Slightly labored breathing. His rate is 20 breaths per minute.
Slightly labored, 20 breaths per minute. We're gonna give just off rip 6 liters per minute nasal cannula. And let's move on to circulation. I'm going to check his pulse and get a rate and then like a quality and then just like the strength of it.
His radial pulse is regular and his heart rate is 110 beats per minute.
110 beats per minute. Okay. 110 beats per minute. And then his skin color and quality?
It is slightly pale and clammy.
Slightly pale and clammy. Okay. We will go ahead and continue the thing while transporting him since he has a variety of chest pain. And then go ahead and start with the sample and OPQRST. So his signs and symptoms so far is it is chest pain, back pain, he feels faint. We're gonna go ahead and go to what brought this on. When did it start?
It started suddenly when I was watching TV.
Okay. Is there anything that makes it feel better or worse?
Nothing makes it feel better or worse. It's just really bad.
Okay. How would he describe it?
Feels like a sharp and tearing sensation.
Okay. How would he rate it on a scale of 1 to 10?
10 out of 10. I've never felt something this bad.
Okay. And then the time that this started?
About 15 minutes ago, I called 911 right away because I knew something wasn't right.
You said how many minutes ago?
15 minutes ago.
And then, does he have any known allergies?
Ibuprofen.
Okay. Does he have any notable past medical history?
High blood pressure controlled with medication, moderate smoker.
Moderate smoker. Does it say what medication he takes for his high blood pressure?
I'm probably gonna butcher it. Amlodipine?
Well, I guess if it's something that's not
Amlodipine.
nitro, I'm not gonna know. But let's see here. Then the last thing that he ate or drank,
Dinner 2 hours ago.
dinner 2 hours ago, and then the event that brought this on was, of course, him just sitting down watching TV, and then this happened 15-ish minutes ago. As you said, he is a fast smoker. I'm gonna move the oxygen I'm gonna give it to him just to 15 liters per minute, just in case. And then I'm gonna give him for his chest pain, I'm gonna give him 0.4 milligrams of nitroglycerin and 324 milligrams of aspirin for all that. And then as we are in the ambulance, I will follow up assessments on other things like his lungs. Do the lung sounds sound normal?
Lung sounds are normal and equal.
Okay. And then we've got his mental, because we asked questions earlier. Skin color and quality is fine. Was he able to move around when you were getting him to the ambulance? Was he like fully capable of moving? He said he felt faint earlier.
He's able to move, but he feels dizzy and lightheaded, like he's gonna pass out.
Okay. I feel like it's something obvious that I should know based on that information. But after 5 minutes passes on the way to the hospital, is there anything that changes in his condition?
98% since you started oxygen, but nothing else has changed.
Oh yeah, I got a full set of vitals. That's the obvious thing I'm forgetting. Awesome.
And you needed vitals?
Yes.
The blood pressure is 160/100, heart rate is 110, his respiration rate is 20, and his SpO2 is 96%, or 98% now that it's on here.
Is that the only thing that changed with me giving him stuff?
So far, yes. That's
Okay.
the only thing that's changed.
All right. I will get to the hospital and then give them my report then. And I will say a 70-year-old male felt faint. He had back pain, and it seemed to also be chest pain. When we got there, he was laying down on his couch. He was fully alert. He was breathing at 20 breaths per minute and a heart rate of 110 beats per minute. We got there 15 minutes after he called. His blood pressure was 160/100. His heart rate was 110. His respirations was 20. And he had a pulse ox originally at 96. After giving him 15 liters of oxygen, it moved up to 98% pulse ox. And then I gave him nitroglycerin at 0.4 milligrams sublingually, and gave him aspirin orally with 324 milligrams. And he still feels faint. He still has back pain. So done.
Is there anything else you'd like to do for your patient?
Not that I can think of, no.
Okay.